Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Did you know that psoriatic arthritis affects more than 1 million people in the United States alone? Welcome to the Patient Audio Guide produced by the nonprofit CreakyJoints and the Global Healthy Living Foundation, and made possible with support from AbbVie. Our mission today? To empower you to work with your doctor for a better quality of life with psoriatic arthritis. Maybe you or someone you love suspects you could have psoriatic arthritis, or PSA for short. Or perhaps you have been recently diagnosed with psoriatic arthritis. Or maybe you've had psoriatic arthritis for a while, but you're experiencing new symptoms or are concerned that it's getting worse. This audio guide can help you better plan for your next doctor's visit so that you can have a more informed conversation about treatment options, disease activity, and more. I recommend taking a moment to grab a pen and paper or open a note on your device because we'll be sharing valuable insights to help you plan for your next doctor's visit. Start planning for a better quality of life today. Remember, this is not a substitute for professional medical care. Always talk to your doctor about issues concerning your health or medical condition. Today we'll discuss how to work with your rheumatologist to have a more informed conversation about treatment options and disease activity. Joining us today is Shilpa Venkatachalam, PhD, MPH, and Director of Patient-Centered Research, Operations, and Ethical Oversight, and Co-President of GHLF Canada. Shilpa is one of my colleagues here at GHLF and also happens to be a patient herself. Hi, Shilpa.
Hi, Angela. Thank you so much for having me today and for this really important conversation.
Shilpa, I really value working with you, and you always bring such great insights to these conversations because you're a researcher, but you're also living with a condition yourself. So you really get to see so many different aspects of what it's like to treat and live with a chronic condition. We really appreciate you sharing your experience with us today.
Absolutely, Angela. I want to start actually by sharing some information about myself for context. My name is Shilpa Venkatachalam, and I work in patient-centered research in chronic diseases and in rheumatic and musculoskeletal conditions like psoriatic arthritis. In fact, I myself was diagnosed with seronegative RA or rheumatoid arthritis in 2017. Then, about 5 years later, surprisingly, it was suspected that I actually have psoriatic arthritis, not rheumatoid arthritis. Of course, this came to me as a shock. And then shortly after that, my diagnosis was again changed to seropositive rheumatoid arthritis, with what I was told were some features of psoriatic arthritis. So as you can imagine, it's been quite a journey. So far, I've tried and been on at least 10 different medications or DMARDs, and I'm on my 11th, which is a JAK inhibitor. I've been on pills, on single therapy, double therapy, combination therapy, injectables, and some have worked well for a very long time, and some really haven't. In fact, some seemed like they would be working initially, but they didn't really after the first 3 or 4 weeks. Unfortunately, this is a very familiar story for many of us living with these conditions. So I guess today I speak from the perspective of a researcher as well as a patient. And like any other patient, I have my own fears and apprehensions about medications, about side effects, my own battles with pre-authorization and frustrations. And then, of course, there's elation and happiness and hope when I try a new medication and wait for it to work. And sometimes it does.
Thanks, Shilpa. So let's dive in and talk about some practical steps you can take to work effectively with your rheumatologist and manage psoriatic arthritis more proactively. Okay, Shilpa, we structured this audio guide to inspire collaboration between patients and their rheumatologists. Here are 8 things you can do to be more prepared for your next appointment. Let's start with step number 1. Define your treatment goals and lifestyle considerations. It's really important to identify what you want to achieve with your treatment. Some common medical goals include reducing pain and stiffness or improving joint function. Lifestyle goals may involve maintaining fitness or balancing work and personal life.
So goal setting is a really important part of disease management, and goals really come in all flavors. Most importantly, goal setting helps you introspect and think about what things really matter to you, right? What can make you live well and be happy while living with this disease? So, for example, your doctor may have goals that have to do with your blood work. Your doctor might want to make sure your CRP levels are in control, or that you're not anemic, or that your fracture is healing nicely. But personal goals can be things that relate to your everyday life. I want to get to a place where I can sleep through the night without waking up in pain. I want to be able to go out with my friends and not have people look at my skin lesions. I'll give you a personal example. Recently, I needed to travel internationally, and then, of course, I fractured my foot. My goal was to find a way to travel despite my fractured foot, but also to make sure I was resting my foot, giving it the necessary time to heal, and so I ended up using crutches and a wheelchair. Another goal of mine was to reduce stiffness, joint stiffness. So I spoke to my doctor, and she reevaluated why I was having so much stiffness in the first place. Was my current biologic not working? Did I need to switch medications? Was I not exercising and doing my physical therapy? These are some of the questions we thought about together. And then we worked on a plan so that in 3 months, my stiffness would get better.
Defining your goals is so important, and being able to communicate that to your rheumatologist is key. Just as important is sharing your priorities and preferences for treatment options. It's essential to clearly communicate what you want to achieve with your treatment. Are you looking to reduce pain and stiffness, or do you want to improve joint function? Also, take a moment to think about your lifestyle and what type of medication would work best for you. Maybe there's more than one way to administer the medication. For example, are you more comfortable with taking a pill, or would an injection be more suitable? By sharing this information, you and your doctor can work together to find the treatment plan that fits your needs and lifestyle the best. It's all about finding what works for you.
And I'll be honest, I'm a researcher. In fact, my research is in this area, and still I have fears like anyone else when it comes to medications. There was one particular medication, for example, that I was taking that was making me very nauseous. So I spoke to my doctor, and she suggested I try a few different things and stay on the medication. But I was not wanting to do that. I just did not want to take that medication. So I sat down with her and I asked her to provide me with other alternatives. And I promised her that I would adhere to the next treatment she would put me on. Together, we made a plan, and I was able to move to another medication. It is really important to advocate for yourself. Your doctor wants what is best for you. And in the end, even the best medication will not work if you don't stick to it. Learn about your preferences, because it will also help you learn about yourself.
Thanks, Shilpa. That's insightful. It's so important for patients to share their priorities with their provider. And that's something that a patient featured in this season of the PSA Club did very well. If you haven't listened to Jonathan's episode, go check it out. And Shilpa, that brings us to our next point, discussing treatment options. When it comes to treating psoriatic arthritis, there's a wide range of options available, including NSAIDs, topical therapies, ultraviolet light, and systemic therapies. During your discussion with your doctor, it's crucial to explore the benefits and risks of each treatment option. Don't hesitate to ask any questions you may have to ensure you fully understand the potential outcomes and possible side effects.
So one of the most frustrating things about living with a disease like psoriatic arthritis is that you just don't know which medicine is going to work for you. You have to try a medication and then wait and watch. Sometimes it works, sometimes it doesn't. It is so frustrating. Meanwhile, the pain and the fatigue is always there, interrupting everything you do. I use multiple things when I'm in a flare or when I'm waiting to see if medication can actually work for me. I ask my doctor about what she thinks too. Sometimes I feel like I'm asking too many questions, and then I remind myself, this is my health after all. I've asked my doctor and I've asked other patients what kinds of braces and splints work for them. If my pain is really bad, I ask my doctor to give me something like an NSAID that can give me immediate relief. If the NSAID causes an upset stomach, I ask my doctor what else I can turn to. All this time, I'm hoping and waiting for my medication to kick in. And I know that it may not, because it may not be the right medication for me after all. I hate that process of waiting and watching and then going through it all over again if needed. But that's happened to me. I was diagnosed in 2017. It's 2024. So far, I've cycled through 11 medications. I know there are options, but I also know that I cannot lose hope. Or maybe I can momentarily, but then I need to do everything I can and use every support I have to get back on track.
Thanks, Shilpa. Something else that's really important is monitoring your progress. Let's talk about that for a moment. Regular monitoring is vital. This could involve various disease activity measures like the Disease Activity Score, DAS, which combines the number of swollen and tender joints, global health assessment, and a blood test marker like C-reactive protein, or CRP, to determine disease activity. The Psoriasis Area and Severity Index, PASI, which is used to assess the severity of psoriasis skin symptoms often associated with PSA, or the Composite Psoriatic Disease Activity Index, CPDAI, which evaluates skin and joint involvement and patient-reported outcomes to measure overall disease activity in PSA.
So these are really important in understanding how you're doing with your disease. These are disease measurements that are important from a research standpoint as well as from a care standpoint. It's really a great advance in science that we have ways of measuring things. How well a medication is working, how controlled a disease is, how active my inflammation is. Imagine if we did not have a way of measuring this, we'd be completely lost. It's like walking in a dark room and trying to find a switch. You may hit a wall, you may break a lamp, you may injure yourself. You don't want to make decisions in the dark. You want to be guided to make the best decisions possible. And that is what measures like the DAS or the CDAI or blood work and biomarkers and labs do. They're a roadmap, a helping hand, a switch to turn on the light so that you know what needs more attention and improvement. How your treatment needs to be adjusted, for example. Think of it like the volume control. You need to find the right volume to enjoy your music. Too loud, and it will hurt your ears and sound like noise. Too low, and you won't be able to hear anything. Measures allow us to understand what to turn up and what to turn down. They help us to figure out if the medication I'm on currently is actually working. And if it isn't, they help us have a conversation with our doctors so that together we can figure the way forward.
I can see how these measures really help you to understand your condition and really figure out what's next. And having these measures might also be helpful when it's time to adjust your treatment. So let's talk about that, adjusting treatments as needed. Don't hesitate to talk to your doctor about adjusting your plan if you find it's not meeting your goals or causing side effects.
So that is a really important point, Angela. It really is very important to keep speaking to your doctor, reevaluating your goals, and adjusting your goals if required. There are so many examples I can give for myself. Recently, I had a lot of foot pain. It got worse over time. Now, first I thought this is a flare, and so I took a course of glucocorticoids with my doctor's advice, of course. And a few weeks later, I had relief for a few days. But then the pain came right back. Next, I was sent to do some imaging. Imaging revealed that I had a lot of synovial fluid and bone erosion, and a fracture that happened without any event, at least as far as I can remember. This made me nervous. I didn't want to switch medications all over again. I told my doctor that I wasn't ready to switch. My doctor looked at me and asked if I would rather continue limping and taking painkillers, eventually even risk having more bone erosion. She even told me I might be unable to stand without pain if I continued like this. She spoke to me about how I was doing myself a disservice, that things would only get worse. Eventually, she and I determined that I did need a new medication, and I eventually started one. So talk to your doctor if you are scared about changing medications and be clear about what your fears are. I was afraid of the side effects of going through a medication that might not work all over again. So speak to your doctor about every fear that you have and develop a timeline to help you assess if you are getting better, especially when you start a new medication.
Shilpa, you mentioned you had to adjust treatments 10 times. Unfortunately, it can take some time to find the right treatment, and that's okay. I'd like to talk about how mindset is an important part of the patient journey. Having patience with your journey is essential, and your doctor is your partner in this process, guiding you to what works best for you.
Absolutely right, but it's easier said than done, isn't it? Sometimes finding the right treatment can even take years. When I start a new medication, which unfortunately, like many others, I've done a few times now, forget the physical side effects. There are so many mental health concerns. Anxiety about if the new medication is going to work. Fears about what the long-term side effects might be. I always worry about my liver and my kidney, for example. Thinking about, well, what if this medication doesn't work? And of course, having to go through all this all over again. These are just some of the fears. This is just the tip of the iceberg. But through it all, you have to find a way to be patient with yourself and with your body. There's going to be a lot of bumps along the way. But chronic illness can also teach you a lot. It teaches you patience. It teaches you to face challenges because you may sometimes have no choice. In fact, it may help to even get a therapist or psychologist to help you navigate the many different emotions that can swell up while dealing with a chronic illness like this one.
Shilpa, you have to be so strong to go through that experience over and over, and that's something I really admire about you. Your patience reminds me of our first episode of the season with Ashley, who very gracefully shares her experience with how she has had to navigate her own journey with a lot of patience. We're getting towards the end of our audio guide and have just 2 more points to make. Let's talk about complementary treatment. I know that is something you've explored quite a bit. If you're using additional ways to manage your symptoms, be open with your doctor to make informed decisions together.
That's because medications alone is never enough. Don't get me wrong, they're absolutely important. But if you don't combine them with other lifestyle-related modifications, then you're not giving yourself a fair chance. We know through research that a multi-pronged approach is very important. And what I mean by a multi-pronged approach is using medications along with other strategies like exercise, healthy diet, sleep hygiene, and so on. Me personally, I meditate because it helps me stay a little calmer, especially when I'm about to go for a blood test or start a new medication. I need to be more disciplined about physical therapy, I'll admit, because I know the research shows that physical therapy helps a great deal to build strength and support your joints. I even try to cook my own food as much as I can, and I've adjusted my diet according to what suits me. That means sometimes sacrificing the things that you love to eat. Observe your body. It really gives you clues, and if you listen to those clues, you will experience the benefits.
Absolutely. Those are all great options to explore. Last but not least, our final point is don't settle for subpar treatment. If you feel your treatment plan isn't working, speak up. Seek a second opinion if you think your doctor isn't fully understanding your concerns.
Absolutely. I couldn't agree more. In fact, in the first years when I was diagnosed and I started on a medication, weeks and months passed and I just wasn't feeling any better. My pain continued, my stiffness continued, and I kept going back to the doctor and telling him that I had more pain and more stiffness. And my doctor kept telling me to give it more time, to be patient, to take NSAIDs. Every time I showed a bony prominence, the doctor would tell me it was the nature of the disease. And so after a while, I stopped and I decided to seek a second opinion. The first appointment of my second opinion was an entirely different experience. It lasted an entire hour and a half. I was examined physically. Every joint was examined and looked at. The doctor asked me about my values, my preferences, what my goals were, and together we drew up a plan. I really didn't know what I was missing until I sought a second opinion. So don't be afraid to seek one.
Your journey toward managing chronic illness may have ups and downs, but by working closely with your healthcare provider and following these steps, you can find the treatment that helps you lead a better life. Remember, it's a partnership, and your doctor is there to support you every step of the way. Thank you, Shilpa, for your insights and for openly sharing about your own journey as a patient.
Absolutely, Angela. Thank you so much for having me. I will say that being a researcher doesn't make the journey any easier. I do know the background. I do know what the research says, but I still have my own apprehensions, my own fears, my own anxieties, just like any other patient.
To our listeners, thank you for joining us on this enlightening journey into managing psoriatic arthritis. We hope that our conversation with Dr. Venkatachalam has empowered you with the tools and insights you need to have more informed conversations with your healthcare provider. Remember, your journey with PSA is unique, and we encourage you to take what resonates with you and tailor it to your own experiences. Reach out to your medical team, engage with support communities, and don't be afraid to advocate for yourself. To learn more about what it's like to live with psoriatic arthritis and to hear from fellow patients like you, check out the Psoriatic Arthritis Club podcast, available wherever you listen to podcasts or at psoriaticarthritisclub.org. If you found this audio guide helpful, please consider sharing it with friends and family who may benefit from it. Your support helps us reach more people who need this vital information. This audio guide is produced by the nonprofit CreakyJoints and the Global Healthy Living Foundation and made possible with support from AbbVie.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.